Now we are moving to two different religious associations and communities, that is Jehovah's Witnesses and atheism agnoscience. To begin with Jehovah's Witnesses, it's worth mentioning that they are gathered in a religious association that proclaims that Jehovah is the only God. Jehovah's Witnesses acknowledge the Bible. They worship Jehovah, so the God that is mentioned in the Bible, Yahweh, as the one true God. The name of Jehovah's Witness comes from Jehovah, from the God. They belong to what is known as the Bible students and represent the mainstream of this Bible students movement. Jehovah's Witnesses were started in 1872 in Pennsylvania by Charles Russell. The history of Jehovah's Witnesses in Poland is quite old and dates back to 1892. Currently, according to official statistics, there are more than 120,000 preachers in Poland. The most important force in the church is the judiciary power of the church committee. So church committee is allowed to decide and to make orders and rules and norms in the religious association Jehovah's Witnesses. When Jehovah's Witnesses doctrine is concerned, it should be mentioned that they do not recognize the sacrament of the sick. They reject and condemn celibacy, although they advise their followers, these preachers, to postpone marriage until after Armageddon. It means the end of the world, so they can devote more time to preaching. They believe that baptism does not take away sins, but is a symbol of consecration to God. They believe that baptism should be a free act, so there is no point in administrating it to young children, and it's for adults that are baptized very often in stadiums, in big, great gatherings. They do not recognize sacrament of marriage. It means that problems of marriage, some troubles and some conflicts between spouses are left to the will of them. The ethics of Jehovah's Witnesses is very focused on neighbors, on interactions between people. They condemn anger towards one's neighbor and immoral thoughts. In their view, true religion emphasizes love of neighbor and observance of God's commandments and biblical moral principles. In their daily lives, they are obliged to beware of lying, dishonesty, hypocrisy, adultery, and homosexual practices, theft, as well as drunkenness, smoking, and also drug abuse. Jehovah's Witnesses do not take part in political life. They do not serve in the military and even do not salute the flag, national flag. Jehovah's Witnesses reject religious holidays, except an annual commemoration of the death of Jesus Christ, celebrated near Easter. In celebrating this day, they pray, sing, read holy texts, they pass bread and wine from hand to hand, but it means that not that Christians, they do not believe in so-called transubstantiation. It means that the bread is not changed into the body of Jesus Christ. They consider the celebration of Christmas as an expression of paganism. It means that they unveil that celebration of Christmas on 25th of December comes from pagan times. Jehovah's Witnesses are famous for preaching activities in big scale. They walk from house to house, teaching and delivering their articles, their journals, and encouraging people to read it. Very important aspect of Jehovah's Witnesses belief concerns healthcare. In general, Jehovah's Witnesses oppose the worship of sacred places and images. They claim it is idolatrous worship. That's why they do not worship the cross. They do not eat food containing animal blood, for example, blood pudding. They do not fast. They consume small amounts of alcohol, are not explicitly opposed to taking other people's tissues and organs. It means transplantation. Every member of the faithful decides whether a transplant is necessary according to his or her consciousness. Every member of the faith decides whether or not a transplant is necessary according to his consciousness. Very important aspect of Jehovah's Witnesses' beliefs and moral attitudes is blood transfusion. According to them, any person, whether an adult or a minor, may under no circumstances consent to a transfusion of blood or blood products. It means that transfusion is not allowed, even to save life. Any person who does not comply with the regulations may be expelled from the organization and, according to their belief, to their faith, she or he may lose eternal life. The position of Jehovah's Witnesses on the issue of blood donation is very extreme. They even do not allow the use of auto-transfusion. Jehovah's Witnesses do not consent to transfusing their own, but extravased blood. Taking one's own blood before an operation and transfusing it afterwards is unacceptable to them. It means that the circulation of blood cannot be interrupted. According to Jehovah's Witnesses, blood is identified with the life, with the soul. That's why they are so strongly and strictly opposed to blood transfusion. For products obtained by fractioning plasma and substances derived from cell fractions, each witness decides individually whether to accept or reject them. It means they can individually decide if they want to use such substances as red blood cell fractions, hemoglobin, white blood cell fractions, platelet fractions, platelet growth factors, plasma fractions, albumin, immunoglobulins, fibrogen, clotting factors. When rejecting blood transfusion, the Jehovah's Witnesses accept to use the blood substitutes. It is possible to use one's own blood provided that it does not lose its connection with the bloodstream. We are continuing the discovery of specific attitudes of Jehovah's Witnesses to healthcare. The central issue concerns blood transfusion and its ethical aspects. The position of the Medical Ethics Committee on problems related to blood transfusion in patients belonging to the Jehovah's Witnesses denomination as presented in anesthesiology and intensive care, is as follows. We believe that the physician should respect the will of a fully conscious adult patient when it is expressed just before an immediate threat to life. In other cases, prior written declarations, and in the situation of the child or a mentally ill person, the decision to act must remain with the physician, his or her duty, experience, and conscience. There are techniques to blood transfusion which minimize blood lost. In case of conscious adult blood transfusion that is not on vital signs, according to Jehovah's Witnesses and their attitude towards blood transfusion, healthcare should respect patients' wishes. Healthcare shall not transfuse blood and treat by all other means. Healthcare should transfer to another physician due to lack of other options. And according to the wishes of the patient, do not transfuse blood, use all other means until the tragic end. In case of adult undergoing surgery, Jehovah's Witnesses claim that if a blood transfusion is planned, but the patient has not given his or her consent before the operation, healthcare should not plan or carry out his procedure. Healthcare should not refer to an institution equipped to deal with such situations. If no transfusion was planned, but this became necessary due to intraoperative complications, transfuse blood according to your consciousness and medical indications is allowed. And after the operation, healthcare should inform the patient about the transfusion. In case of adult patient from accident that is unconscious, patient's documentation indicates she or he is Jehovah's Witness. It means that blood transfusion is, if medically indicated, should be informed. The patient should be informed about transfusion. In case of pregnant and postpartum women, according to Jehovah's Witnesses, providing professional nursing care for the women as for any other postpartum women is allowed. When preparing an obstetrician for a Caesarean section, observe the religious instructions concerning the administration of blood products and blood substitutes. It means that the central case is the blood in these operations. When the newborn and sick children are concerned, in the community of Jehovah's Witnesses, there are no specific recommendations in the available literature for the care of a child. So it is up to the nurse to provide professional, caring care as for any other child. It is accepted that the life of the child is a primary value that takes precedence over the protection of religious beliefs. In the domain of adult patients, Jehovah's Witnesses expect that healthcare would provide professional nursing care as for any other adult patient with additional elements. First, obtaining knowledge of religious precepts regarding the patient's food intake. Second, enabling family members and relatives to communicate with the patient. Third, enabling adherence to dietary recommendations in accordance with the faith requirements, not serving food containing animal blood. Fourth, provide an environment for prayer and Bible reading for the patient and visiting members of the congregation. And fifth, allowing the patient to communicate with the hospital liaison committee. When the healthcare face the dying patient and when the behavior with the body of the death patient is concerned, according to Jehovah's Witnesses expectations, healthcare should inform the family of the patient's conditions as soon as possible. Healthcare should provide family members and relatives with contact with the dying person, allowing them to stay with the dying person. Healthcare should also acquaint the family with the hospital regulations, provide seclusion that provides an environment for prayer and Bible reading for the patient and visiting members of the congregation. Healthcare should also allow the patient to contact the hospital liaison committee and should allow to perform post-mortem vetting. Now we are moving to the last part of our presentation. It means atheism. Atheism is defined as the lack of belief in the existence of gods. This lack of faith is the result of either deliberate choice or an inability to trust religious teachings that seems literally unbelievable. It's not a lack of faith born of mere ignorance of religious teachings. For some atheists, merely not believing in gods is not enough, and they go further. They actively profess a belief in the non-existence of specific or at all gods. The mere lack of belief in gods is often referred to as a view of weak atheism, while the belief that gods do not and cannot exist is known as strong atheism. Another important category is agnosticism. The term agnosticism was coined by Professor Huxley at the meeting of the Metaphysical Society in 1876. He defined an agnosticism as referring to persons who rejected both strong atheism and theism, and who believed that the question of the existence of a higher power was unsolvable and irresolvable. Another way of expressing the same idea is that an agnostic is someone who is convinced that we do not know with certainty whether God exists. Some agnostics are convinced that we will never know about God. In recent years, however, the term agnostic has been used in different meaning for those who simply express the belief that the evidence for or against God is inconclusive, and hence their indecision on the matter. Between atheism and agnosticism, there are some similarities and differences. Some patients to whom nurses and chaplains offer spiritual care are atheists and or agnostics. Chaplains are nurses who have lived most or all of their personal and professional lives in the Christian community may feel uncertain or uncomfortable offering spiritual care to patients from different groups, such as atheists or agnostics. An atheist believes that God does not exist. An agnostic has no specific belief as to whether God exists. They have values and beliefs based on the idea that people are fundamentally good and that problems can be solved through reason rather than religion. It is very important to know some rules how to care atheist or agnostic patients. For first, do not assume that the atheist or agnostic patient was previously part of an organized religious tradition. Their families may be atheists or agnostics, or they may not. It may be helpful to encourage family members to share their stories so that the dynamics present in the hospital room are clear. Don't assume that atheists or agnostic patient is angry to God. These patients have come to their spiritual beliefs through their own unique journeys. Their spiritual choices may have much more to do with what they chose to do or to go to than what they choose to walk away from. Don't be afraid to engage the patient in a conversation. If she or he feels comfortable enough, feel free to ask about their spiritual journey. If you understand their journey as an atheist or agnostic, it will be easier to be a more effective nurse for them, a more effective nurse or a chaplain. Don't assume that a patient who is an atheist or agnostic will change their mind and undergo a huge spiritual metamorphosis during the dying process. It would be probably insulting uh, for atheist or agnostic patients if you ask them about conversion or that the chaplain works with a nurse uh, and do not respect their beliefs, their atheism and agnosticism. If there is time in these days of short hospital stays, ask the patient to tell you some stories about himself, as you would with any patient. If possible, ask, what has given the deepest meaning to your life? This answer may help you understand the patient's spiritual beliefs from a new perspective. Be an effective chaplain, an effective nurse. Offer your open heart, open mind, and deep listening to these special patients as you do with others. Patients, no matter who they are, will recognize genuine care. Know that there is a greater than usual chance that these patients will not want a visit from you. They may have had previous experiences with a chaplain or member of the clergy or a nurse practitioner that left them unhappy or worse. Know that more than with religious affiliations, you are dealing with an individual approach to health, illness, and death. You should therefore ask rather than assume that the patient is not acting according to principles defined as religious. Very helpful for the understanding of atheist or agnostic patients is a case study that I will now present. I was once called to an atheist woman who was out to dinner with two of her best friends. She suddenly collapsed in the restaurant and her family friends called the aide. Tests at the local hospital revealed she had a brain tumor and underwent emergency surgery. I stopped to see her the next morning. She was dazed but conscious. I asked her if there was anything I could do to support her as a chaplain. She asked me to do two things: to ask permission for her two good friends to visit her in the emergency hospital. She had no family, and secondly, to find new batteries for her hearing aids. I asked her for an empty battery pack and set off. I spoke to the care manager, who immediately agreed to let her friends visit. They waited downstairs all night, and I went to the lobby to give them permission. I witnessed a poignant reunion of close friends before leaving the hospital that day. The next day, the patient was fully conscious. Her first words when I stopped were, "You are not going to pray for me, are you?" I smiled and said, "Actually, that thought had not occurred to me." I asked how she was feeling and if the batteries had arrived. She was a bit frustrated. She had trouble putting them in. One of her friends always did it for her. Would you mind if I did that? I asked. She looked a bit hesitant, but she handed me her batteries and I put them in. She looked at me with a smile. I know they don't teach classes on putting in hearings and aid batteries in seminars. I nodded and told her that I had worked as a speech pathologist for 10 years with many people with hearing aids before I went to seminary. I had to walk away and asked if there was anything I could do for her as a chaplain today. She smiled and said, "You have already done that. Thank you." An extensive literature in the social and medical sciences links religiosity with positive health outcomes. Conversely, secularism is often assumed to carry negative health consequences. However, recent research presenting different types of secular individuals complicates this assumption. Using a nationwide sample of American adults, health outcomes were compared between atheists, agnostics, non-religious theists, and theistic members of organized religious traditions. Results indicated that atheists had better physical health outcomes compared to other secular individuals and members of some religious traditions. Atheists also reported significantly lower levels of psychiatric symptoms, such as anxiety, paranoia, obsession, and compulsion, compared to both other secularists and members of most religious traditions. In contrast, physical and mental health was significantly worse for unaffiliated theists compared to other secular and religious partners in most outcomes. Religious non-affiliates did not differ overall from those with a religious affiliation in terms of physical health outcomes. Although atheists and agnostics had better health on some individual measures, including MBI, number of chronic diseases, and physical limitations, but had worse positive and mental functioning, social support relationships, and health behaviors. Agnostic is somebody that for whom life after death is unknown. Atheists. Most atheists are materialists who believe that death is the end of life. There is nothing after that.